September is National Childhood Obesity Awareness Month. According to Houston Department of Health and Human Services, 34% of children in Houston 12 and older are overweight or obese. Sean Barrett, Director of Nutrition and Fitness at Legacy Community Health, is here with how parents can help their children stay healthy. Sean, good morning. Thank you so much for chatting with us this morning.
Thank you for having me.
We know students are back in routine, right? School is well into more than a month of classes already. How big of an issue, how serious of an issue is obesity among children?
It's a pretty big issue, especially in the South. So in Houston alone, like you said, we have 34% obesity. That means we're above the 95 percentile in weight for the community. That means we're already starting to get diabetes, hypertension. We're starting to see fatty liver disease even in younger children now. And that just escalates as they get older.
Yeah.
So if we don't start working on these problems now, then later in life they become more complicated.
And it's really hard to get ahead of something that's already progressed as they get older and it's not under control.
Correct. So if we're not talking about it, then it becomes a problem. And it's how we talk about it too. So it's very important not just to talk about the weight, but to talk about the health and the overall picture with the child.
Yeah. So often we put a lot of stock into the appearance portion of it, but we don't really talk about the impacts from a health perspective as to what can really go on. Talk to us with that. You know, we've identified the problem here, the issue. Talk to us about solutions on what parents can do to have these productive conversations with their child.
Well, it's sitting down with your child and talking. It is eating dinner at the dinner table, talking about what's happening during the day. It is seeing where they're at mentally. Weight is not always about food. Sometimes it's about mental health. Sometimes it's about inactivity at school. Sometimes it's genetics. So we have to look at the whole picture, the whole child, and just kind of figure out how we're going to get to that next level, how we're going to work on weight, but without talking about weight, by talking about health.
And one thing with that, we have to be very cognizant not to use shaming tactics to achieve this success when it comes to your child's health. Yes.
By shaming children, we see an increase in eating disordered or disordered eating, and that becomes problematic over time.
And I can't help but think that this could also be a component to bullying too. It's a cyclical issue here that can have a lot of impact in other areas of one's life.
Yes, weight on social media we see time and time again as causing problems with children with bullying, shaming, which increases eating disorders and disordered eating.
Talk to us about some of the resources Legacy Health offers to families.
Well, Legacy has some great resources. We have a pediatric program at multiple locations. We also have school-based health programs where we keep a nurse practitioner in-house where if a student gets sick or has a problem, instead of just seeing the nurse, they have a nurse practitioner which they can walk out with a medication prescribed for them and a diagnosis, get a school physical, so they can get that continued care throughout their life, throughout school.
Comprehensive care.
Yes, they do therapy. We have therapist programs. We have behavior health. We medical. We do the whole picture, the whole child.
Yeah. And again, we always say it takes a community, and it really truly does.
It does.
And looking beyond that immediate family, sometimes for that help, for those resources, can certainly go a long way.
Yes.
Okay. Sean, thank you so much for your time this morning.